Dr. JoAnne Foody, and I'd like to welcome you to CardioCareLive. Today we'll be discussing the topic of are we getting better at identifying atrial fibrillation patients at high risk of stroke. And I'm joined today by Dr. Michael Ezekowitz, who is a professor at Thomas Jefferson Medical School.
One other point that I'd like to make here was in that the original paper that we published in the New England Journal, we found an imbalance of myocardial infarction. They were higher in the dabigatran doses compared to warfarin. This was not statistically significantly different, and the FDA have not issued any form of warning regarding myocardial infarction relating to dabigatran. The other point that I'd like to make is that 30% of the RELY patients had objective evidence of coronary disease, but the myocardial infarction rate in absolute terms was very low, 0.8% for the dabigatran groups and 0.6% for the warfarin group. In terms of all-cause mortality, here again the 150 dose proved superior with a statistically significant reduction, 12% in percentage terms, and vascular death a 15% reduction, which was also statistically significant. In terms of major bleeds, there was a nice dose-response relationship between the 150 and the 110 dose of dabigatran, with lower bleeds in the 110 dose compared to the 150 dose, and both were less than warfarin. The 20% reduction in major bleeds in the 110 dose was attributable to fewer GI bleeds, and I'm going to get back to that in a few moments.